Welcome back. As kids head back to school, health officials want to remind parents and caregivers to stay on top of your child's health, and that includes getting routine vaccinations. Joining me now to share what parents need to know about back-to-school vaccinations is Dr. Lisa Chu. She is the Director of Clinical Innovations at the Association of American Medical Colleges. Good morning, and thank you so much for joining us. Let's jump right in and tell us, why is it so important for parents to stay up to date on their child's vaccinations?
Thank you, and it's great to be here. Vaccines are the best way to protect your child from severe illnesses and many infectious disease, particularly when they get the vaccine at the recommended age and the recommended dose. The U.S. Department of Health and Human Services has reported that the vaccination rates for kindergartners remain at their lowest level in 2 decades. And the problem is, when the vaccination rates drop, this opens the door to outbreaks of vaccine-preventable diseases. So ensuring that kids stay up to date with vaccines is really important to protecting children and protecting all vulnerable members of a community.
That's good information. Tell us why we're seeing a decline in vaccine rates in some kids.
Well, we're seeing some vaccine rates in some children because I believe there's some difficulty with access to the vaccines. And also we're seeing a rise in parents and guardians requesting exemptions for vaccines, where kids may not be getting many of the vaccines that are required for schools because of reasons of health reasons, philosophical reasons, or religious reasons. And we're really urging parents to forego those exemptions so that their children can be vaccinated, to protect children who may not be able to get the vaccine for other health reasons.
And this is something that I struggle with. What if you are scared of getting a shot? How can you help?
Yeah, that's a great question. There's a lot of evidence that shows that vaccines are safe and effective. If you have concerns about the vaccine, it's really important to talk with your healthcare provider about your concerns. They are really a trusted source of information and support.
And it's hard to believe it's been 4 years since the COVID-19 pandemic. What are some of the symptoms and signs you guys are seeing right now?
For COVID-19, we're definitely seeing a surge in the United States, especially across 42 states and more. And some of the symptoms that we're seeing are fever, cough, a runny nose. Some people may lose their sense of smell and taste. We're strongly recommending that people get the updated COVID vaccine this fall. A lot of the surge is driven by the new variant, JN1, and this new vaccine that will be available in the fall will be targeting those current variants.
And when can we kind of see, I guess, a spike in some of the COVID cases? Does it really happen a certain time of the year?
Yeah, that's still a little bit unpredictable. We're definitely seeing a surge currently, which was earlier than what we had predicted. And we may anticipate that there may be another surge this winter. So it's really important to get the vaccine that will be available this fall to protect you from additional surges in the winter.
And how often should kids get their vaccines?
The COVID-19 vaccine in particular is now becoming an annual vaccine. So we recommend getting the vaccine this fall and every year due to the circulating environments to stay up to date.
Thank you so much, Dr. Lisa Chu. Thank you.